Hi, I'm Liz Miller, and I am a diabetes specialist. I work in the field of diabetes and pregnancy, and I've been doing this for about 20 years. And today we're going to talk about physical activity before, during, and after a pregnancy with diabetes. Just so that you know, this is just considered a resource and not a standard of care in California or any of the states. And you're advised to adapt the guidelines and resources based on your level of care at your facility and your patient population. So this is strictly just to give you some guidelines. So our objectives today will be, number one, list the benefits and potential risks of exercise or activity for women with diabetes during pregnancy, discuss maternal and fetal responses to exercise, state the contraindications to exercise during pregnancy, describe guidelines for exercise during the antepartum and postpartum period, identify glucose values and carbohydrate needs for physical activity, and we will also be reviewing the types and appropriateness of bed rest physical activity. This is something that's important, and so after we review the general guidelines, we're going to focus on some new information for bed rest. And then certainly we're going to also talk about postpartum areas and some creative ideas that we can do or implement for our moms to appreciate those challenges of a new mom post-delivery and how they can make time for their exercise. And of course, the activity falls into the ADCES 7 self-care behaviors. As you can see here, it is the second one on the list, but really, if you think about it, it does impact all 7 of these. Food is connected with the activity, as well as monitoring blood sugars, taking medications, or maybe having to take less due to activity. There's definitely some problem solving involved to keep your blood sugars where they need to be, reducing the risk of a low blood sugar, and it really does help with coping with the management of diabetes. So the first thing we want to ask, and really we can ask ourselves this as well as our patients, is what is your experience with exercise? Is it good? Is it bad? Do you enjoy it? Do you find it a chore? Are there barriers? We've talked about some of the negative sides of it. And what really motivates us to exercise or to be more active? You know, for some people, they want to be around for their family. For some, it's an activity or an outfit they want to buy. Maybe a wedding's coming up or something along those lines. But what we hope to achieve today is that we want to think a little bit differently and view exercise or activity, as it's called now, in a better light, and that there are some creative ways to work it in. It doesn't have to be a set marathon. You know, that's some people do that, but there's varying levels of activity that can be beneficial. So again, we'll review the basic information, and then we're going to show you the different areas for bed rest and postpartum ideas that can help with that. Now, activity for most pregnant women, whether you have type 1, type 2, or gestational diabetes, can continue throughout the pregnancy. Women that are active beforehand can certainly continue during, but there usually is some modifications. But before we get into that, let's talk about the benefits, the risks, and the recommendations. What are the maternal benefits of activity during pregnancy? Well, we know it's going to increase insulin sensitivity and glucose utilization, so blood sugars come down. The carbohydrates are certainly utilized as well. It's going to increase and maintain muscular strength, which is important. Maintain the cardiovascular conditioning. It will help facilitate recovery for our moms and give them a general sense of well-being. It can also foster positive behavior and lifestyle changes and can help reduce some back pain. It improves mild to moderate hypertension. It can reduce excessive weight gain and also to make sure the baby doesn't get too big. It can also reduce the risk of preeclampsia. Can help have a higher incidence of vaginal delivery versus C-section. There has also been associated with it a lower incidence of gestational diabetes, preterm birth, lower birth rate. C-section delivery is essentially lower, and then, of course, hypertensive disorders. The fetal benefit, we already mentioned this, it can actually reduce the chance of the baby being too big. What are the risks? Well, low blood sugar, and for some women, their blood pressure may actually be exacerbated if they already have some chronic hypertensive needs. There's always a risk for musculoskeletal injuries due to the softening of the cartilage. And for the fetus, they say it can cause some fetal bradycardia, although this does not seem to cause any serious problems for the baby. All right, recommendations for all types of exercises, pregnant or not, is to always have a warm-up and a cool-down. For warming up, the recommendation is 5 to 10 minutes, and that can be just a real easy type of warm-up or walk with a slightly slower based song, for example. And then start out slowly. Exercising too hard or too fast can result in injury, which we don't want. We've got to get our muscles ready for that. Women are encouraged to exercise with a partner or a friend whenever possible. And with the risk for low blood sugar, that is always a great recommendation. You want to wear supportive clothing and carefully select footwear that will protect your feet and help you while you are active. And of course, we always want to train our women to know the signs and symptoms of hypoglycemia and always carry a source of fast-acting carbs. Glucose tablets, for example, are always good to have with you. There should always be a convenient location. If it's not close, people are not going to do it. It's always good to vary your exercise routine and drink plenty of water. Always important to set realistic goals. We don't expect people to do marathons. You got to walk before you can run. It does help to try to schedule particular days for exercise. If it's every other day, that's fine at a certain time, maybe before work, after work, walking at lunchtime, for example. And always prudent to avoid exercise in hot or humid weather, especially right now. The weather's been very, almost like a sauna, I'd say. And so we don't want pregnant women, especially if they have not been very active, to be in this type of weather. And as I mentioned earlier, we want to make sure that we cool down with plenty of time to get the heart rate back to its normal state. Now, we do have to consider many of our moms in their childbearing years that have diabetes. We are seeing a lot more women that have pre-existing conditions, complications from their diabetes, for example. So women that have cardiovascular disease, hypertension, neuropathy, or any type of microvascular changes in their eyes or kidneys really should see their doctor first to determine if it is appropriate and okay for them to be active while they are pregnant. Okay, now let's go into how we go about all this before and during pregnancy. So what are some safe things to do? Walking really is the best. It gives you, you won't have to worry about injury. You can walk outdoors. You can walk on a treadmill. I'm always encouraging my patients to do this. Some type of cardiovascular aerobic activity is good. If not, they can also be in the water. In the water, they're very buoyant, and we don't, again, have to worry about any type of injury to their knees or their pelvis or anything like that. Now, they can also do some step aerobics, but they have to be careful as they get farther along, because a bigger belly means that it could actually block the vision of the step, and we don't want them to miss it. But early on, it's certainly fine. And low impact aerobics is always good. Women can use a stationary bicycle. The regular type of bicycling is fine in the early pregnancy, but as you get farther along, it should be more recumbent just because of your tailbone and the pressure from the baby. And stepping machine is considered okay, including the elliptical, and then, as I mentioned already, swimming. It's always important to encourage our women to do some pelvic floor related exercises. That's always encouraged before, during, and after. Stretching exercises are good. Resistant exercises such as using weights or elastic bands, where you can pull things evenly back and forth in a slow, continual fluid motion is good activity. Using light weights. We usually recommend up to no more than 3-pound weights. 1 or 2 is probably best because we don't want to pull anything in our wrists, our elbows, our shoulders. Dancing is always good, and trust me, there's a plethora of different dance styles. And then there is some yoga that women can do while they are pregnant as well. Okay, continuing on with guidelines. I call this the FIT guidelines. I know it says frequency, intensity, and duration, but duration also means timing. So if you put fit seems to work well with activity because you do become fit. So as we review this, the frequency would be about 4 to 6 days a week. At least take one day off or so. And you can do low to moderate intensity. And then between the cardiovascular type of activities, we should also include some toning or resistance type of exercises in between the aerobic type of exercise. 2 to 3 sessions a week is good. So, and every other day type of thing works well for this. The intensity should be about 50 to 80% of the heart rate. And what they recommend is using the Borg's rating of perceived exertion. Now, with the Borg's rating, that is a perceived exertion of 6, which is no exertion, where you're sitting still, not moving at all the way up to 20, where that's maximal exertion. And you want to be about 13, which is about somewhat hard, so that when you can do a talk test, you can still talk, but you're not overexerting yourself to the point that you can't talk at all. So 13 is considered the best spot to be with that. And the time, how long should you do it? What is recommended is at least 150 minutes per week spread over 3 days with no more than 2 consecutive days without activity. You really do lose the benefit of the activity if you go longer than 2 days. And the other thing that we have noticed, when you are active, your blood sugars come down roughly 30 points, roughly 30 minutes after. Now, in the early part of the pregnancy, women are more sensitive. They may drop more. But 30 minutes, 30 points is a good general rule, especially when we're dealing with some insulin resistance with the pregnancy hormones. But if you do go longer than 2 days, the benefit of your blood sugars definitely are not there. By 2 days, it definitely starts to go up. So your body is very fuel efficient for the first 24 hours from that activity. Okay. So as I said, 30 minutes or more is good on most days, and that comes up to about 150 minutes each week. Moderate activity is appropriate, okay? And if a woman has been exercising consistently before pregnant, she usually can continue that routine through most of that pregnancy with minimal problems. She might need to slow down a little bit more as we get into that third one, but certainly wouldn't have to start out as slowly as someone who perhaps had not exercised at all. And again, just as a reminder, we don't want women to exercise to exhaustion. And if we are just doing moderate activity, a quick warm up of the cool down of that 5 to 10 minutes should work quite well and get the maximal benefit of the activity. Strength training. Okay. The biggest thing with strength training is good posture and proper technique. It's not about how fast you can do the reps or how quickly you can do the reps or how much weight you can lift. Again, the reminder is please start with light weights. 1 to 2 pounds is fine. It has to be very slow, controlled movements. In other words, 2 seconds lifting, and as you're bringing it down, 2 to 4 seconds. You never want to hold your breath, okay? And the recommendation is that you breathe out when you're lifting up for those 2 seconds, and you breathe in as you're lowering it for 1 to 2 to 4 seconds. Now, you can add more repetitions if the exercises do start to become easier. You only increase the weight when it becomes very easy, Okay, you do get some more strength and toning with this, but let's not start at the highest end. You always want to start at the lower end and continue that every other day. You want to give your muscles time to rest, and that's why it's recommended every other day. And of course, we always stop if there's any other signs of discomfort. And then the weight size, as I mentioned, it does depend on the mother's level of fitness. But if somebody's new, start at the lowest weight. Okay, now, what are some examples of some exercise fitness? With strengthening exercises, whether you're using light weights or working out at the gym, things like an overhead press, shoulder raise, rowing, there's upright and low rowing, crossing the chest, when one arm bent over, we have our biceps, triceps, we have about maybe 3 or 4 different ways to work your tricep. There's the leg curl, a wall sit where you're actually kind of squatting, but your back is against the wall, and a standing squat. These are safe things to do, and you can actually find a nice visual of this on the CDAPP website if you look under exercise. Exercises to avoid. Obviously, we don't want our moms lying flat on their back due to the uterus. We want to make sure that blood flow is good. Anything that would be a high impact abdominal trauma or imbalance, no gymnastics, horseback riding, any type of contact sport or anything used with a ball so we can avoid injuring the belly. No scuba diving, please, no hot yoga or Pilates. And then we also have to keep in mind, is the insulin peaking? We want to try to avoid that. And again, can't emphasize enough, no hot or humid weather. Many women will notice a slow recession in the exercise activity in pregnancy, partly because of the changes that are going on in their body. They're tired, the nausea and vomiting. And so once they get past that, usually by the second trimester, they're feeling pretty good. But then when they get into the third trimester, then we start getting into some other changes. Obviously, their center of gravity is off, and the blood flow and heat production, things like that, start to have more of an impact on them. And so we always tell our women, do what you can. Some days are going to be better than others. When should you stop exercising? Anytime you have any type of pain, whether it's contractions, pain in your abdomen, your calf, chest, any leakage of any type of fluid, amniotic fluid, vaginal bleeding, maybe you don't feel the baby move as much. If you get dizzy, there's an alteration in your conscience, your headache, nausea, short of breath, those are always indications that you should stop. Now, there are some contraindications for exercise. Some women just are not able to do this right now. If you have a significant cardiovascular disease or lung disease, or some women have multiple gestations or they're very much at risk for preterm birth, they're not able to really exercise. Any bleeding or previa after 26 weeks, ruptured membranes, preeclampsia that's not well controlled, severe anemia, and even incompetent cervix or with a cerclage. Now, I have seen with that one, some women are able to perhaps do some walking. It really depends on the severity of their cervix. Some women can't do anything, all the way to the point that some women can do maybe a little bit. So it just depends on their certain situations. Okay, let's take a minute and let's talk about how to handle blood glucose. Some of you may be familiar with this, others not. But as I mentioned, since blood sugars can drop a good 30 points, we really want to make sure that their blood sugar is not low. If it's low, as you see down here at the bottom, we really do need to treat it first and get that blood sugar back up, even above 100, because if they drop 30 points, then we're going to be right back down here to the 70. On the other hand, we also don't want them above 200, okay? For our type 1s, once blood sugars start to get above 180, we run that risk of ketones and potential DKA, so we don't want that. And if they're really up here, hopefully they're not pregnant up here, this needs to be taken care of, definitely need to check for ketones. There's going to have to be a call to the doctor with some insulin. So the sweet spot really kind of has to be between 100, 160, something like that, because with that exercise, then we can keep them in goal. And of course, we always have a snack with us at all times. When they're using the insulin, the preferred side is the abdomen, below the belly button. After 24 weeks is fine. Try not to use an arm or a leg, because we know with that, heavy exercise will cause the insulin to work a little bit quicker. And again, can't emphasize enough, keep that fast-acting carb and try to avoid exercising when the insulin is peaking, particularly the fast-acting. Drink plenty of water before, during, and after. Usually I recommend every few songs if they're exercising to music. If they're going to be active longer than 60 minutes, we have to also remind them and keep in mind that activity, your body is very fuel efficient after an activity, and blood sugars can potentially still drop up to 12 to 18 hours, maybe even 24 for some sensitive patients. So we need to keep this in mind, and we will have to have a decrease in either the intermediate or long-acting insulin. All right, let's take a minute to talk about the 15-15 rule. This is a treatment for low blood sugar. And what we do with this is it's 15 grams of carb, which could be things like 4 glucose tablets, and a cup of non-fat milk. Skim is preferred, 1% is fine. Certainly don't want to use whole milk because there's too much fat and that'll take too long to work. Juice will reserve for severe low blood sugars, 30s, that kind of thing. But that's 15 grams of carbohydrate. We would ingest that, or the patient would ingest that. We wait 15 minutes, and hopefully we should see an increase in the blood sugars to come back up, especially get it above 70. Okay, it has to be at least 15 points higher or greater than 70. If not, we definitely need to repeat it. So this is where that 15 rule comes from. And then once that blood sugar is above 70, definitely need to follow up with a protein carb snack or a meal, because the carb gets them up, the protein will keep them from falling. Okay, you want to make sure that you have a meal consisting of carbs and enough protein, at least 1 to 3 hours prior to any physical activity, so that it is in their system and working, and they're not going to be glucose depleted. If their exercise routine is going to be greater than 60 minutes and strenuous, it is a really good idea to make sure that they have 20 to 25 grams of carb at least every 30 minutes while they are in this strenuous activity. Okay, let's talk about how pregnancy changes to physical activity. All right, so what we have going on here is, from a breathing standpoint, oxygen and blood flow are directed to our muscles and away from other areas of our body, because that's what's being used. While pregnant, oxygen needs increase, and now this can also have an effect when we're trying to do some type of strenuous activity. The heart rate is going to be harder when they're pregnant, and when they're exercising. So they may have less energy for exercising, because we also have to make sure that oxygen is getting to the baby. And then their temperature, they can become quickly overheated, especially as she starts to sweat. And it usually tends to happen at a slightly lower body temperature. We also have to keep in mind that the woman's balance is off a little bit, and their body shifts from that center of gravity, and more stresses can be placed on the pelvis and the joints in the lower back, and it's very easy for them to lose their balance because the ligaments are relaxing and preparing for that delivery. We want to avoid any jerky or hard bouncing type of impact, which could increase the risk for injury. Okay, let's talk about what goes on each of these subpoints here. From a cardiovascular change on blood flow, we're going to see an increased blood volume. Now, interestingly enough with this, the blood volume does start to progress at about 6 to 8 weeks gestation, and will reach its max at about 32 to 34. And you're going to see an in volume and an increase up to 50%. And so since there's extra blood flow to the uterus, there's going to be some extra metabolic needs for the baby because we're continuing to have to perfuse the organs as well as that uterus. There's an increased stroke volume in terms of the heart contracting, and there should also be decreased vascular resistance to help the heart pump the blood. And you'll start to see this earlier in the pregnancy at around 8 weeks. with that increased cardiac output, it should reach its maximum for output between 20 and 24 weeks. And the output is very sensitive to changes in the body position, which is why we don't want to lay on our back, because then that uterus will be on top of that inferior vena cava, and then we're worried about the flow of blood from the feet back up to the heart. Keep in mind that because the woman's heart rate is a little bit higher, she may get to her maximal heart rate a little bit sooner. As far as blood flow goes, remember that blood flow has to also go to the gut, it goes to the uterus, it goes to the muscles, skin, and kidneys, as well as the baby. So they should avoid lying down in that second and third trimester, as I've mentioned. Even motionless yoga, we have to be a little bit careful about that. We don't want to decrease the venous return. So any yoga poses should be some motion in it, not completely sitting or lying still. Now, if there are vascular diseases already from the diabetes and hypertension, we may need to modify those movements and not be as active. Metabolically, we know that the blood sugars are going to increase due to the hormones, but the exercise will help keep that down, but the baby is also pulling from the mom. When the blood sugar starts to drop, cortisol is supposed to help increase that sugar, but by making new sugar from the liver and getting glucose and non-carb sources out to help with that. Glucagon is supposed to help with that, but again, if that counter-regulatory mechanism is off, you definitely need the fast-acting carbs. From a musculoskeletal point, balance is so important. That's why we ask women to be very careful if they've not been cycling or running before. We don't want them starting that now because we don't want them to fall or get hurt. We don't want any harm in their pubic symphysis or the sacroiliac joints. So non-weight-bearing activities such as swimming or a stationary bike, which actually activates the large muscle groups, would be better. Again, watch the temperature and the humidity for body temperature. That's why we need to make sure maybe exercising in the morning or in the evening would be better, or in a mall where if you're going to walk. And from a fetal standpoint, we want to also make sure that the baby is doing okay. And again, I alluded to this earlier, the baby's heart rate could go up a good 10 to 30 beats per minute, or it could drop a little bit. But from the reports that are shown with exercise, this really does not seem to have any lasting effects on the baby or have any adverse fetal developmental concerns. So those small changes seem to be all right for the baby. Okay, let's get in and talk about some of the new things here. I want to touch on this. Let's talk about bed rest. Now, there are actually 4 types of bed rest. As I was researching this, I found this very interesting. There's the strict no upright position bed rest, where the patient has to use a bedpan or bed bath and elevate to about 30 to 45 degrees to eat. There is the strict Trendelenburg, where the head of the bed is down 15 degrees and it's lower than the feet. And there is absolutely no upright activity. They have to use the bedpan or bed bath, and they can actually roll to their sides and be propped up a little bit to eat. There's bed rest with bathroom privileges, okay, where the patient can shower in a shower chair or use the bathroom, and then limited seating in a recliner, for example, to eat is okay. And then there could be just limited activity where there's no restriction to toilet or eat or shower, and just have to watch the amount of activity that they do. So it goes from severe to less, but those are the 4 types of bed rest. So we have to also think about the benefits of the exercise. We know that if they can do some bed rest activity, it'll actually help reduce their stiffness and strain, and there won't be as much muscle weakness after they're off their bed rest. And that's a big deal. Trying to decrease that weakness is super important. It'll help their posture. It'll help with the circulation. and we can avoid deep vein clots. And believe it or not, constipation is a serious problem for our patients on bed rest. So if they can actually do some activity, it can help decrease that. The other concern is that mentally, they can get very bored and have a lot of anxiety. And so we have to think about not only the physical concerns, but the mental concerns that can happen from this as well. And so usually what is recommended, and you can certainly encourage this with your patients that are on bed rest, is tell them this is a good time to maybe catch up on some movies or read books. They can learn a new skill, such as knitting, or learn a language. I've seen patients do that. They can journal their thoughts and experiences about the journey of their pregnancy. What we're hoping to do with this is that if they will get on a schedule, if you will, it gives them a sense of purpose. So in other words, when they start their day, they're going to get up, they're going to eat, they're going to check their blood sugar. Then at a certain time, they're going to do their hobby. They're going to read. They're going to have a certain time to do their exercise. And the exercises can be spread out 2 to 3 times a day. Have visitors, take a rest. And so by doing that, they're going to have a little less problem with the sensory part of this and feel that they've got some sense to their day as they continue to stay on bed rest until their baby is born. Okay, so how can the exercises be done? Carefully, slowly, and throughout the day. We don't want to strain or hold their breath or use their stomach muscles. We need to perform warm-ups if they can, sitting on the bed. And then, of course, they should stop or report any amniotic fluid loss, contractions, or bleeding to their provider. Now, one of the questions we get with this is, well, maybe they shouldn't exercise at all to avoid this fluid loss or this bleeding. It's more important that they get some activity to help with muscle strength, decrease that weakness. If they're going to have a loss of fluid, it's going to happen. But anything that we can do to help maintain their physical integrity is important. All right, so the next couple slides that I'm going to show you here show the proper way how to do exercises in bed. For example, getting in and out of bed, if they are able to do this and they're not on strict bed rest, is it's a really good idea to do what we call ankle pumps or circles. So those of you that are sitting there, you're sitting in a chair, if you put your legs up and do some circles or point your toes straight up to the ceiling, up and down, if you can do that, you understand why. You can kind of feel it in your calf muscles as you're doing that. I'm doing it right now as I talk to you. So you want to roll on your side, okay, raise the head of the bed, and then push up with their arms while swinging their legs. Because if you notice here, you don't want to be trying to sit straight up. This is the more appropriate way to do this. And some basic things while they're in bed, pillows are an excellent support for their stomach, behind their knees to avoid any strain. Some type of memory foam or anything like that is always very helpful. You could roll a towel if you don't have a pillow. Okay, relaxation. We always should include a little bit of deep breathing and mindfulness when we talk about exercise. To me, that is part of the package. And so you want them to breathe through their nose and out through their mouth slowly. They can lay on their side with their hand to their stomach to feel their breath move in and out. And, encourage them to close their eyes as they start this, to relax each body part. Some people can do this really well. Relax their toes, ankles, heels, work all the way up to your scalp. The other thing that we would encourage is, as women are starting to do this exercise and they're stuck on bed, encourage them to get a massage. Just do a quick little neck or shoulder massage, either from the night nurse or perhaps their partner who's there, because, well, that's going to make the partner feel more included. But it really does help them, because when you're stuck on bed rest, people don't realize that you really do start to get very stiff in your neck and shoulder area. Okay, so what's recommended 2 to 3 times a day was starting out with 5, working up to 10 repetitions. So we're going to basically start from the head and work our way down to our feet. So we're going to target the neck and shoulders here. You can do a thing such as chin to your chest, up and down, roll your head left and right. And I would encourage you to do this while we're sitting here. These are always good exercises, whether you're standing, sitting, or in bed. Your shoulders, move them up to your ears. and down, circle forward, relax them, repeat backwards. Hopefully you're doing this with me. Pull your shoulder blades together. Put your arms straight out in front of you and stretch. Okay, if they're lying down, they can lie down, arms to the side, and reach towards their knees. Tighten and release their fists. Bend and straighten their elbows. If they're on their sides, this is interesting. You can do some arm circles, big and then small, forward and backward on both sides. Okay, here we're working the lower half of the body. They can slide their heel up and down. So lay flat, bend that knee, and then bend it all the way back to their buttocks, and then slide it back down. Put it on their leg and slide it up and down their leg to get a little more, and then turn the leg out, okay? By turning and the heel left in and out, we can get some activity taken care of for the legs. And again, pointing those toes to the ceiling and tightening the thigh muscles and pulling the kneecaps towards your waist for 5-second release is good too. The legs especially tend to get very, very stiff, so these are good things to do. You can roll your knees in and out like the picture shows here. For your ankles, this is always important to do. Again, circle your feet one way, then the other. If you're able to sit, bend and straighten your knees 5 to 10 times. Get that circulation flowing. Okay, they can do some side leg lifts if they're on their side. They don't recommend back kicks, especially if there's a placenta previa, but for those that don't have that, you can just bend your leg back and hold it there for a 5-second return. Leg push with the resistance bands. I've seen PT people come up and give them resistance bands for their legs, for their arms, to do some activities that way, and they just attach it to the bed rail. The elbow curls, pull your shoulders back like you're rowing, and of course the arm raises. So these are all helpful things that can be done. Okay, now let's talk about activity after pregnancy. I do think there's some very creative things that can be done this time frame. Now, there are 2 areas that have to be focused on after a delivery. Okay, as soon as it's physically and medically safe and the doctor has given them the okay, it is okay for them to start doing some modified activity and build on it. We don't want to go gangbusters here. Usually what is recommended is obviously the pelvic floor exercises and some stretching that can be done, but the target's going to be on their abdominals and their upper body, their shoulders, because remember, you've had that center of gravity off, your whole spine is out of line, then they're holding the baby and probably bent over a little bit, so shoulders and hips become the primary part to focus on right now. It can take 4 to 6 weeks after delivery to try for women to kind of feel more stabilized before they can start exercising. And we have to also keep in mind, especially for our moms with diabetes, the demands of breastfeeding lower people's blood sugars. They are recovering. They get more lows in the postpartum period because they're busy taking care of a baby. And then we're going to add exercise to this. So change in meds are important, snacks are important, and starting out slow. Okay, already talked about this. Insulin needs usually drop quite a bit. Same for oral agents as well. But if they're exercising, it's okay, because anybody who's adequately nourished, it should not have a negative impact on their breastfeeding or their milk supply. And as the old adage is said, it's 9 months on. You've been pregnant for 9 months. It's going to take 9 months to get back, up to a year or so. Okay. So what do we want to focus on? The first 1 to 3 months, it's emphasized is staying healthy and getting back into a routine. Okay. By 4 to 6 months, we can concentrate on some lightweight training and a little more cardio. And then by 7 to 9 months, we can start rebuilding their strength starting to do more higher intensity cardio. But again, that really does vary per patient. Now, keep in mind, somebody who's had a C-section versus a vaginal delivery, the needs are going to be different. Let's start with the C-section. There's usually major surgery with this. Their incision has to heal, and we need to make sure that both mom and the baby are okay and there's no increase in bleeding if we're going to consider some type of activity, okay? But for those that can, with doctor approval, start exercising, again, doing those Kegels, pull your belly into your spine to kind of strengthen the back and the shoulders. Light walking is certainly fine, and usually they can start to do this about 8 to 10 weeks after their C-section, okay? For a vaginal delivery, light walks are good. The Kegels, we want to continue with that and strengthen that pelvic area, and they can usually start to resume that at about 6 to 8 weeks without any serious problems. And again, I mentioned we want to strengthen that abdomen, pelvic tilt, even some planks and some yoga moves can be very helpful to help the core muscles without putting too much strain. We want to help them strengthen that upper body because remember they're carrying the baby and all the paraphernalia that goes with carrying a baby, the backpack and the diaper bag. And so we want to strengthen our back and our shoulders. And you can use the baby to actually do this if you're careful. Slow, even movements. Use the baby like a weight going away and from mom can be a great way to help strengthen those shoulders. One of the things moms always have a concern about is no time, okay? And new moms, as we know, have even less time. They're tired, they're trying to figure out, I've got to take care of this baby, and now you want me to exercise. So one of the things we encourage them to do is you can get creative with this. If you have a mat, put the baby along the side. Baby's not going to be crawling anywhere anytime soon. And so that way mom can do some of these pelvic and upper shoulder exercises because the baby's right near them and they're still with their baby. Slings are a great thing to have too. You can do some squats while you have the baby in the sling and you're holding your baby. Okay. Again, slow, even movements, very fluid. And this doesn't require a lot of time or activity. And then during quiet moments, you can continue to do things like squats or wall sits or touch your toes if you're sitting in a chair, modified push-ups from the wall, that kind of thing. Okay. Again, because of the emotional concerns, women are very overwhelmed caring for a baby, okay? Or there's also the concern for depression or baby blues. The body image thing is always a big concern, and we have to tell them, be realistic. It's going to take a little time to get your body back. Some women who do want to exercise can often feel tremendous amount of guilt or anxiety about taking time away from the baby, and oftentimes they will tend to skip or perhaps shorten their activity. So that's why it's real important to make sure you include the baby. And as you can see in this picture here, they've got some mommy and me type of exercises that can be done. And that way, this is a win-win. Mom can be with her baby, she gets out to socialize, and she's also getting some activity. Okay, here's another example, what I talked about earlier, having the baby with you in a sling and doing some leg raises. The mat thing we talked about. Baby carriers. There are now these groups where women can go out to the park and take their baby with them. They have stroller walks. They use the stroller as a balance to do some lunges or some squats. So to me, I think that's pretty clever and a neat way to incorporate activity and make it a family event. Okay, so here's an example of what I was talking about. They can certainly dance with their baby. The number of dances and themes that are out there is phenomenal. It blows my mind. For example, Zumba. I'm a Zumba instructor. When I started learning this, I was absolutely surprised at the amount of dance activities that are available with your patient. Okay, now what I've got here, this is just an example of a schedule visually that people can use. You can do aerobics 3 times a week, and it could be anything from walking to swimming later after they're recovered to Zumba or dance classes. Then in between, they can do some toning and flexibility with the resistance 2 times a week. Stretching is always important. Warm up and cool down. Maybe you want to do some yoga. As I mentioned, post-delivery, walking is always good, and then slowly we can start to add those 1-pound weights. Work the arms, abdomen, the glutes, the thighs. And then if they're back at work, chair exercises are always good. One of the cutest things that I can share from a chair exercise is think about a song that you know. There's always an intro, a verse, chorus, verse, chorus. Very, very simple. You can actually do a complete head-to-toe workout, whether you're standing or if you're sitting in a chair, and work everything. Let me show you. I can't actually play a song due to copyright things, but if you have a favorite song, the intro can be your shoulders and your head and your neck. So do those circle rolls or the head movement. When the verse comes on, work your arms. When the refrain comes on, do your abs. You can push your legs out and back if you're in a chair, for example. Next verse, do your lower legs. Refrain comes on, you do your abs. Very simple, very easy to do, and then you're getting a little bit of exercise and enjoying your favorite song at the same time. Okay, so one of the things we encourage is do little movements here and there. So I'd like to take a minute, if I could, and go through and talk about just maybe some little creative things. And what this really boils down to is kind of taking an inventory of your schedule, what you might already have at home. And I encourage healthcare providers to do this. And then once you've done that yourself, encourage your patients to do the same thing. On this page here, this one talks about just some other things to add a little more activity to your day. If you can take an extra flight of stairs, go up one level instead of taking the elevator, absolutely do it. Gardening is really good activity. People's blood sugars actually come down when they're doing gardening. You can park a little bit farther away, unless you already park farther away. You can walk a little bit after a meal. Maybe you can get a coworker to walk with you at work. Stand up and stretch every hour. Okay. That might be a good time to do some of those chair exercises to a song. It clears your mind. You're going to be better able to focus on your work. Try to walk an extra 8 minutes a day in your neighborhood. You can cut your lawn, and then you can give up an evening dessert or save desserts for the weekend. Now, one of the other things I want to focus on here in the next few minutes that we have left is to re-look at what you can do. Notice things around you. Take a look at your home. Take a look at what your park or where your work is and see what you can add to get in a little bit of exercise. Believe it or not, it will actually add up. And before you know it, you have reached the daily amount of exercise or more that you need. If you're at home and you're waiting for the coffee to finish brewing your coffee, you can do some leg lifts at that time or some twists and turns. If you're on the phone, twist your body. If you're working by the washer and dryer, you can do some arm push-ups or some squats as you things out of your washer and dryer. If you've got a vacuum, do some lunges. Do some plies when you put the dishes in and out of the dishwasher. Wash the car. There's all sorts of things that you can do at home. Do some exercises when the commercials are on. If you're at work, we talked about a few of these. You can park farther. You can walk at lunch. We actually had a couple nurses that decided to walk on the unit during their lunch break. What happened with this story is that they were actually trying to help a patient get some activity in. So they would come in, walk with this patient, and after the patient was discharged, they were like, hey, I kind of like this. I'm going to keep walking. So we actually encourage the nurses to do that just to get closer to their 10,000 steps, and it worked pretty well. You can take the stairs. We got the chair exercises I just mentioned. If you're getting coffee at work, that's a good time to do some of those leg lifts or, move your leg in front behind you, each side. At the park, consider what's at the park. Is there a trail you can take? Is there some playground equipment? I have seen people do some step-ups on the park benches and seen them do some tricep workouts. You can walk along the beach if there's a beach near the park. again, that stroller club, lots of different things to do in terms of that. Now, I do want to take a minute and talk about what do you have at home from a mindfulness perspective. Again, I mentioned this earlier at the beginning of the talk. This is an important component of activity. Activity does a really good job of helping people relax and reducing their stress. But I also think that now that you should also try to incorporate some of this when she has some quiet time with her baby. And by this, you can dim the lights, you can put some soothing music on, or maybe you've got one of those sound machines or a little diffuser. Maybe she wants to put a little, I don't know, lotion or lavender lotion, something like that can be very comforting for many women, and put that on. But just having a few quiet moments not only will calm her, it will also calm her baby. See what you have. I took a little inventory of my home, and I was surprised at all the things I had. I had apps on my phone for exercising, to do yoga. I found out I had a stretch band and some light weights. I had a yoga mat. I had a little foam roll that I could do for any sore muscles that I had. And then I had the spray. So each night I would do one of those things. I maybe would put a candle on, dim the lights, spray a little lavender on my pillow. And by doing that, I felt more motivated to do that. And I actually had a more restful night. As far as a woman's schedule goes, is it easier for her to get 10 or 15 minutes in first thing in the morning or right before bed? Yoga is a great thing to do first thing in the morning. Again, alternating with the stretch bands and things like that. So certainly something to think about from an environmental standpoint in terms of just working in some what I call me time, or code lavender. That's the other word I've been using for that. So those are just some examples of things, and I hope that will give you some ideas of what you can either use yourself or give to your patients if they're looking for some creative ways to get this done. And oftentimes they find more things to do even like that if they're even on vacation or that kind of thing. So it can certainly continue wherever they go. All right, so first of all, I want to thank everybody for attending today. This actually will conclude our presentation, and I appreciate your time. Thank you very much.